AM 560 The Answer.
Chicago's Morning Answer continues next. Your official Chicagoland weather forecast from the 1 Hour Heating and Air Conditioning Weather Center and our meteorologist, Steve Williams.
Today, increasing cloudiness. High today, 52. Clouds tonight, rain and drizzle late, low 41. Rain and drizzle, cool day tomorrow. The high tomorrow at 51. Variable cloudiness Wednesday, high 59. I'm Steve Williams on AM 560, The Answer.
40 at O'Hare, 41 along the lakefront. Your next news update is at 8:30. Worried about basement flooding? It's time to call Permaseal, 800-421-SEAL. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
Top of the morning, Dan and Amy. You want to play the Listen to the Experts folderol that you hear from shutdown and bust politicians? You can play that game. We've been doing it for 2 months. Your expert has credentials. Meet my experts. Here's 6 of them that have better credentials than your experts. It's more than that. It's the quality of the analysis and how it holds up over time, particularly with suggestions of what may be true that we yet don't know. The humility, that's a factor that should be attached to the quality of insight you give every expert. What I know and what I don't know, how we can find out what we don't know. So Michael Levitt, he's a 2013 Nobel Prize winner in chemistry. He's a structural biologist. He's a computer science professor at Stanford. Anybody can beat those credentials? And over at Stanford,
Not even you can beat those credentials.
We've talked to the former head of neuroradiology at Stanford Medical Center, Dr. Scott Atlas. We talked to the founding director of the FDA's Office of Biotechnology, Dr. Henry Miller, also now at Stanford. And they're invariably saying the same things. So perhaps those who believe that everybody should be treated the same and the shutdown should go on in perpetuity and that there's only one consideration to make might want to listen to some cognitive dissonance from people who know a thing or two about infectious disease and healthcare. Michael Levitt, in this interview he gave with Freddie Sayers on Unheard, talking about the lockdowns.
I think it is a huge mistake. I think we need smart lockdown. If we were to do this again, we would probably insist on face masks, hand sanitizers, and some kind of payment that did not involve touching right from the very beginning. This would slow down new outbreaks. I think for example, they found, as I understand, that children, even if they're infected, never infect adults. So why do we not have children at school?
Oh my gosh.
Why do we not have people working? Everybody panicked. They were fed incorrect numbers by epidemiologists. And, this, I think, led to a situation. There's no doubt in my mind that when we come to look back on this, the damage done by lockdown will exceed any saving of lives by a huge factor. One very easy way to see this.
And look, Michael Levitt also says some other things in the interview I disagree with in terms of where he's coming from. He's clearly somebody concerned about population growth where I am not. So I don't just accept everything Michael Levitt says because he has all the credentials. I accept it based on the argument he makes, the evidence he provides, the predictions he made about the exponential versus logarithmic growth of the viral spread back in March, which have largely come true. That's the quality that should be the focus of making decisions based on making decisions in terms of, is this somebody who is providing keen insight that should inform public policy making? He also, by the way, shares the opinion of another expert we talked to, Martin Kulldorff, who's a professor at Harvard Medical School. At the end of the day, we're going to probably find that Sweden's model of shutting down, protecting, sheltering in place the older and those with comorbidities, and otherwise leaving the economy and civil society open for the younger, will have been the best in terms of balancing the sole public health concern with the public health / economic concerns. So for those who, as we saw over the weekend in the coverage here in Illinois, about the people protesting for reopening and calling for balance, including medical health professionals. These are just extremists and science people and hate mongers and so forth.
Yeah, they don't care about the elderly and
they
nursing
don't. Right.
homes.
We're going to throw Granny. We're going to throw Granny under a bus, and I love that argument too because I keep hearing it. So people like Michael Levitt, we're throwing Granny under a bus, but the people who've actually presided over Granny being thrown under the bus. Nursing home deaths that account for 50% plus of all deaths in Massachusetts, 35% of all deaths in Illinois, they haven't thrown Granny under the bus.
Oh, the number in Illinois has gone up over the weekend. Now it's near 60.
And the slow response and the ABC7 New York report about how 75% of nursing homes in the country failed to have a pandemic plan as required by state laws that they could execute after the outbreak.
I'm sorry for interrupting, but a lot of nursing homes are disgusting. They're poorly run. They're filthy.
And a lot of them are not. And still, because all these people, America's governor, Andrew Cuomo, who have the third eye insight into the future, except they didn't see this. And you know who actually did see it? You know who actually did move with perhaps the most alacrity of any governor? Is the one who's been criticized perhaps the most. And I would say the most alacrity on the issue of long-term care facilities, Ron DeSantis in Florida, who has a lower fatality rate, one of the lowest in the country, particularly for a populous state, significantly lower by a factor of like 35 as compared to New York and New Jersey. But DeSantis is reckless, and Phil Murphy and Andrew Cuomo are geniuses. Okay.
And he did that by protecting the nursing homes.
For more on this, we're pleased to be joined by Ramesh Ponnuru. He's a senior editor at National Review, columnist for Bloomberg Opinion, visiting fellow at the American Enterprise Institute. Ramesh, good to have you again. Thanks for joining us.
Always a pleasure.
So just before we get to some of your pieces about how America is doing writ large, some of the comparison contrasts that we're now discussing, the Texases and the Floridas versus the New Yorks and the New Jerseys, even the Texas and the Floridas versus the Californias, which have otherwise done well. And these laboratories of democracy playing out their various approaches, but the different standards of analysis that are being applied to those different laboratories.
Yeah, I think people have had a hard time getting a handle on a lot of aspects of this, and I think that your point earlier about having some humility is well taken. And one of the things people have had a hard time getting a handle on is just the extreme divergence between parts of the country and their experience of it. It remains the case that the New York area is responsible for, I believe, something like a third to a half of the deaths in the United States. And, I think there are some obvious reasons for this, but we don't have a full explanation of it. And yet, people do have this need to make these sort of confident predictions, like, so when Georgia decided to open up, there are reasonable arguments on both sides of that, but people were saying, mark my words, in 2 weeks it's going to be a bloodbath. Well, no, that has not turned out to be the case, thank goodness. And people really should be, willing to take a deep breath and say, well, I'm not sure this is the right way to go, as opposed to you are going to have blood on your hands and Georgia will be, a crater.
Well, every new report of a COVID, case in Georgia is biblical right now because the mainstream media is all over, like, we told you so, what you just said. But there's other parts of this country, like Oregon. They've had 104 total COVID deaths, 104. And the governor extended the lockdown to July 6th.
No, state of emergency, not lockdown.
It's not lockdown. Okay, state of emergency till July 6th. But I mean, there's no uniformity in any of this.
Yeah, that's right. And the other thing is, and I think that all of us get a little confused on this point, whatever side people are on all these debates, the extent to which a lot of this was just voluntary. People have not been actually waiting for governors to make these decisions in a lot of places. So, for example, a lot of Florida was already socially distancing before the governor, was sort of browbeat into doing something because, the counties moved, the schools moved, individuals decided that they were going to take precautions. And we all tend to be a little bit sort of government-centric about these things when we're talking about it in the public sphere. But it's, our society is much less government-driven and much more kind of decentralized and individualistic than people give us credit for.
Well, right, and here's the thing about this too, and you're seeing it even in Southern California today with protests about beach closures. There was a legitimacy conferred for the lockdowns initially, and now that legitimacy is waning in most states.
Absolutely.
And so this is legitimacy in and legitimacy out. The idea that people are just going to sit back and be dictated to in most states is folly.
Well, that's right. And, to the extent that you do want people to be taking sensible precautions, doing absurd things like an evidence-free crackdown on beaches, even beaches where people are maintaining separation from each other if they're not connected, that just renders the entire thing ridiculous and makes people less inclined to comply, even with the sensible policies.
Our governor in Illinois, as well as Governors Cuomo and Phil Murphy, all the governors of the worst-run states in America, have come together in agreement that the idea Mitch McConnell advanced that I'm not going to do blank check block grants for bad financial decisions that predate COVID-19 at the state or local level, but we will take under advisement the idea of creating a provision in the federal bankruptcy code for said states. Well, that's rejected as a dumb idea. Is that dumb?
No, absolutely not. So few people have paid attention to what McConnell actually said. And McConnell was not closing the door on helping state governments and localities out with legitimate expenses related to the coronavirus. What he said was, we're not going to be excited about bailing out the pension mistakes that states have made, and what people have said in response is, oh, that's an invented issue. Nobody's talking about bailing out the state pensions. Well, the president of the Illinois State Senate he wrote a letter to Congress asking for $10 billion to help bail out the state pension. And McConnell's been around a long time, and he understands that's an opening bid. And if you said to Illinois, yeah, $10 billion for that, suddenly Connecticut is coming at you with, a request for more in New Jersey, and all of a sudden a generation of mismanagement suddenly gets pushed off on federal taxpayers, including taxpayers in states that have managed their pensions well.
Well, have other lawmakers or, from other states such as New York and California asked for a pension bailout as we so boldly did?
That, I have not seen them do it, but I'm sure they would like it. These are states that have been making promises to their employees for a long time and not putting the money aside to actually make good on them. So, you get to a crunch at some point, and of course they're all going to be looking to the federal government for help.
He is Ramesh Ponnuru, senior editor for National Review, columnist for Bloomberg Opinion, visiting fellow at AEI. Ramesh, always a pleasure. Thanks for joining us.
You're welcome.
Take care.
And he joined us on our turnkey.pro answer line.
And Amy on the AM 560 The Answer mobile app. Just text the word app to 64636 to download the app today.
Keeping up with all the codes and life safety measures that need to be in place for new construction or even your existing facility can be a major headache. Get with Bartkowski Life Safety Corp., a specialty contractor whose focus is on life safety, especially for healthcare and institutional buildings. They're a full-service, nationally certified life safety and specialty contracting company that offer a complete line of fire stopping and life safety installation services. Bartkowski's staff are experts who will ensure code compliance in your facility and will be with you every step of the way during your Joint Commission or Department of Public Health inspections. Prepare now for the future. Bartkowski Life Safety Corp. is your life safety resource. Minimize schedule delays, cost overruns, and code compliance citations on your next project with Bartkowski Life Safety Corp., based in South Holland, Illinois. Contact them at 708-498-0004. That's 708-498-0004. Or online at bartlsc.com.
So I've been doing it. I take Balance of Nature because I want a strong, healthy immune system, especially